Hello. In this video, we're going to walk through the journey of an adult cancer patient, from diagnosis to prognosis to treatment in Lebanon. The prices and rates that will be shown display the remaining balance a patient pays after a third-party guarantor has covered its portion and is demonstrated in Lebanese lira compared to the American dollar. While the ministry and other guarantors are using a fixed exchange rate of $1 to 1,500 lira, hospitals are using the black market exchange rate, which we'll assume to be $1 to 20,000 lira. The patient's journey begins with an appointment at the specialist, where the consultation fee is 600,000 lira. From there, the specialist orders the required tests, like an echocardiogram for 400,000 lira, or a mammogram at 400,000 lira, CT scan, 3.5 million lira, MRI with contrast, 2.5 million lira, PET scan, 4 million lira, blood tests, 2 million lira, biopsy, 15 million lira, and the cost of a colonoscopy is 1.5 million lira. When a patient begins therapy, the cost of their monthly visit to the doctor is 600,000 lira. Chemotherapy treatments every 3 weeks is 4 million lira, and some of these patients have 3 treatments a month. The medicines that the patient takes after every therapy session to help with immunity, pain, and so much more, 2 million lira. This doesn't include other medications the patient takes for conditions like high blood pressure or diabetes, 3 million lira. Radiation therapy costs can range anywhere from 25 million lira upwards of 70 million lira. And if a patient requires hospitalization, the hospital requires that the patient pay 30 million lira upfront prior to any admission. And if the patient needs to be admitted into the intensive care unit, the cost is 20 million lira per day. And when it comes to surgeries for these patients, like a mastectomy, the cost of the procedure itself is 120 million lira. And with that, each cancer patient has so many other expenses: nutrition, vitamins, and mental evaluations if they're able to access and afford them. And after that, there are supplies like colostomy bags, 3 million lira, wigs, 6 million lira, adult diapers, 1 million lira. And yet, the monthly minimum wage in Lebanon is still 675,000 lira. While many believe that adult cancer patient treatments are covered by the Ministry of Health, this is a huge misconception. Of all of the expenses that we've outlined, the Lebanese Ministry of Health doesn't cover 1 lira. The Ministry of Health doesn't cover the cost of doctor's appointments, tests, or imaging. Not even the necessary medications the patient pays for out of pocket. The ministry may provide medications at their Quarantina dispensary, assuming it's available. But the problem is when it's nowhere to be found, because a patient won't be able to afford to pay the thousands of dollars for the medicine located outside of Lebanon. And because of this, hundreds of patients are being forced to halt their treatment because they can no longer afford it.